Welcome to Life Unlimited, the show where we dive into the tools, insight, and expert advice to help you live a healthier, happier, and more empowered life. I'm your host, Nora Oliver, and today we're talking about something that affects all of us, our physical health and mobility. Whether it's recovering from an injury, dealing with chronic pain, or strengthening an often overlooked part of your body, like the pelvic floor, physical therapy. And that plays a crucial role in helping us move better and feel better. Yet, so many people either don't know where to go or start and wait until they're in a serious pain before seeking help. That's why I'm thrilled to have Dr. Stefanie DePaul, who is a doctor of physical therapy. Stefanie is an orthopedic, sports, and pelvic floor physical therapist. She is functional dry needling certified, a certified strength and conditioning specialist, and also a registered yoga teacher. She owns a PT practice in Stoneham, Massachusetts called Boston Health and Wellness. Stefanie has completed 15 marathons all over the world, and 6 of them being the world's marathon majors. Stefanie is happily married to her husband, James, and loves being a mother to her 3 sons, Sam, Christian, and David. She also has 2 King Charles dogs that she brings to work for emotional support for her patients, and their names are Samuel Adams and Paul Revere. We'll be diving into how physical therapy can help prevent injuries, improve recovery, and even address issues like postpartum healing, back pain, and much more. So if you ever wondered how to keep your body strong, heal more effectively, or even take care of yourself better, like pelvic health, this episode is for you. Let's welcome Dr. Stefanie to the show. Welcome, Stefanie. It's so good to have you here.
Thank you, Nora. This is great to be here.
Great. So can you tell us what inspired you to specialize in orthopedic and physical therapy and pelvic floor physical therapy?
Sure, yeah. So it was sort of a journey to get to where I am today. So I started as orthopedics and sports. A lot of people, when they go to PT school, they dream about helping athletes and working with athletes, right? So most people, well, not most people, but a lot of people start orthopedics, sports, athletes, and then they sort of find their another specialty along the way, and that was my journey. So I started orthopedic sports, outpatient physical therapy, working at a clinic, not in a hospital. I was working downtown in the financial district. I worked in the North End for a little while, and then I started my own practice in Stoneham, and it was orthopedics and sports when I started Boston Health and Wellness in Stoneham. And then I had a baby. So a lot of pelvic floor stuff happens,
you had to experience it
and
yourself.
It revolves around pregnancy. It's not exclusive, though. You can have pelvic floor dysfunction and be a male, a female, and not be pregnant, which we'll go over all that. But a lot of times, because of the weight of the baby, the relaxin hormone that sets in to loosen your tissues, soften your tissues, open up your pelvic floor, it creates a lot of issues after, including incontinence, what have you, which we'll dive into. But so that led me to pelvic floor. I had a really big baby with a 99% head. It was my first baby, and during delivery, I wasn't coached very well, when to push, and there was a lot of trauma, and I required 36 stitches after giving birth to my first baby. And I said, well, how am I going to fix this? Like, I know how to fix every part of the body except this part. So I became pelvic floor certified to help myself and then help other people with the same issue, because I'm not the only one out there, I'm sure, that needed help
you're not.
After giving birth. And now it's a huge part of my practice. It was only 10% at one point, and now it's about 50-50 orthopedics and sports and pelvic floor. So about half of our patients are pelvic floor, and we can help you with any type of pelvic floor dysfunction that you have going on.
Wow, that's incredible. Good job with all that.
Yeah,
thanks. That's a lot.
Yeah, I didn't just pick it. It happened.
Yeah, especially, and it came from personal experience.
Yeah.
So that's a lot more meaningful because you know exactly what goes in from being the patient, what you experience.
Right.
And the help you want to receive.
Yeah, unfortunately that happened to me, but I ended up making lemonade out of lemons, right? And making it part of my business. And now I love treating the pelvic floor.
That's awesome.
Yeah.
So why do you think physical therapy is so important for overall health and well-being?
Yeah, sure. So physical therapists are movement specialists, right? We specialize in all sorts of movement. My major for my undergrad was kinesiology, which is the study of human motion, right? So biomechanics of the shoulder, the hip, the low back, your gait, the way you walk, we specialize in human movement. So you need a physical therapist. Whether you're injured or not, you should get an evaluation just to see your posture. Everybody sits with really poor posture. We're all looking down at our phones. There's a new condition called tech neck, which is kind of like tennis elbow, but tech neck, or texter's thumb. These are becoming new layman's terms because everybody is sitting with poor posture on their phones, is what the world has sort of turned into. A lot of people sit for work, where standing desks are becoming more of a thing, or desks that go up and down. So you really should see a physical therapist if you're not injured, so you don't become injured. It's turning more into prevention and maintenance. You can get an evaluation for your posture. So yeah, it's really important to see one because we are movement specialists and we can help you stay healthy before you get injured.
Wow, so you do, like nothing's wrong with me, but I feel like, could I just do an appointment with you just to make sure everything is great with my body?
Absolutely.
Like, you do that type of appointment?
Yes, we do. Yep.
That's awesome.
For prevention and maintenance, yes.
Oh, that's good.
But yeah, there's usually something, like, oh, my neck hurts a little bit, or I sit forward when I work. And so usually there's some type of issue going on too that you might not even know about.
Right, exactly. And I know especially with the neck injuries too, or you might not even realize you have a lot of tightness.
Yeah.
So that sometimes, can cause dizziness and other issues that you may not be aware of, but you're taking medications or, doctors don't figure it out. So yeah, definitely a lot of reasons to come see you.
Yeah, it's better. It's more holistic. Instead of popping pills and taking medication, you can do exercises and stretches to help reduce or remove your pain, right? I'd rather pick the exercises and stretches than popping pills.
Exactly, right? You're getting to the root cause of the problem and fixing that. That's awesome. So what are some common orthopedic injuries or conditions that you treat?
Yeah, so for orthopedics, we see a lot of low back pain. That tends to be the number one thing, usually associated with sciatica, which is inflammation to the nerves that come from your lumbar spine or your low back and then go down your legs and create numbness and tingling into your leg, one or both legs. We do a lot of neck pain and postural syndromes, a lot of rotator cuff stuff. You always hear rotator cuff. Yeah, I know, sitting up nice and straight. We do a lot of knees, like ACLs, and we do a lot of plantar fasciitis, Achilles tendonitis. So we do have a shockwave machine at our Stoneham office, which heals old injuries. So if you have a nagging old injury that just won't get better, and you've gone to PT elsewhere, you've tried everything, we do have a shockwave, which is very rare. They're usually only in Boston. So yeah, we have that machine that'll restart the healing process and make the body think it's a new injury. So yeah.
That's great.
I know.
Wow.
Yep,
Wow,
we also do dry needling at our location, which is the same thing. It's faster repair and recovery. We do a lot of cupping. So we have all the modalities for orthopedics to help you heal faster.
That's awesome.
Yeah.
That's great. What can physical therapy help people avoid, like surgery or any other post-surgery issues?
Yeah. So a lot of people will come to PT if they don't want to have surgery. And about 90% of injuries can be treated with physical therapy. That's why when you go to the orthopedic surgeon, they say, okay, I'm going to refer you to PT for 6 weeks. And then if you're still not better, then come back and see me. Because 90% of injuries.
That's a very high
It
rate.
is. Something hurts and you don't want to do the work. A lot of people don't want to do the work, so they don't want to strengthen what's weak and stretch what's tight. So they just want someone to cut them open and fix it, right?
Oh.
And that's not needed. Only 10% of the time that's really necessary.
Wow.
And so you have to put the work in, and you have to see a PT first, because most times you don't even need surgery. You might need a cortisone shot, so then you might need to go back for that, and then come back to PT for a little bit more time, and then usually 90% of patients get better without it. Patients that do require surgery, however, like an ACL reconstruction, ACLs do not heal on their own. There's no blood flow, so you need to have it reconstructed surgically. You do have to come to PT after to rehabilitate that joint. So if you don't do that afterwards, you won't strengthen what's weak and you won't stretch what's tight, you won't get your motion back, and then you'll have an issue in that joint probably for the rest of your life. So
wow.
PT,
so it's very important to start early, even if you feel like you don't have any issues.
Yep.
it's worth it.
Yes.
Because when you're 50, 60, 70, that's when you really feel it the most.
Yeah,
I
you'll
feel
really
right?
start to feel things for
Right.
sure.
And then it's what? Is that too late or
Never too
something can
late.
be
We
done?
can always work with what we've got. It takes longer. The longer you wait to come in, the longer you'll expect to be
because
there.
it's a deeper issue.
Yeah,
right?
it's a chronic older thing. If you come like the first day you injure yourself, you'll get healed really quickly, right? But if you are putting it off, something old, chronic, and scar tissue lays down, healing stops, right? So that takes a lot longer to dig out there. So yeah, get in, get often.
Yep, a lot
And get in
simpler,
quick.
less time to heal.
That's right,
And then,
yeah.
of course, you get into that habit of taking care of yourself, too, post-PT, because
Yeah.
you're getting the tools how to take care of yourself.
That's right. Yeah, you'll get a home exercise program at your evaluation. You'll get a prescription for exercises and a frequency of when you're supposed to come in to physical therapy. It's 3 times a week for the first 2 weeks, and then it's twice a week for the next 6 weeks, typically, to really get ahead of it. And then you need to be doing your home exercise program yourself at home every single day to heal that injury. Otherwise, you just won't get better.
Yeah, no, I agree. And I love that. I've actually taken both of my sons to physical therapy. They don't have pain.
Yeah.
But, sometimes, like, for example, my oldest son, he grew, he was to here, and within a year, he's taller than I am.
Oh, yeah.
And he grew a lot, so he started forming this, his back, started
Yes.
creating this curve.
That's called kyphosis.
Oh, there's a term for it.
Yes.
And I started freaking out. I'm like, hey, this is not normal. And I'm like, because he just, honestly, I didn't expect him to grow so fast, so
Yes.
tall. And he just got stuck in that
Yeah.
moment, that weird frame. So yes, I started him physical therapy. I'm like, you know what, I'm getting this
Exactly
done.
right.
But nobody tells you, right? You go to the doctor and they're like, oh, you look fine. This is great.
Yeah.
Like, you don't have pain, you're great. If you
Yeah.
have pain, take some Tylenol, take Advil.
Right.
Maybe it'll go away. But
Yeah.
you're not actually fixing the problem.
No.
So
why you have to
honestly,
come to PT.
You have to be your own doctor sometimes and make that decision.
Yeah.
It's worth getting that appointment versus not doing anything and waiting for it to be too late.
That's right.
So real quick, so many people don't realize the importance of pelvic floor health.
Sure.
Can you explain what it is and why does it matter?
Yeah, so many people will say to me, Stefanie, I don't even know what the pelvic floor is, right? And these are my favorite patients because then I have an open platform, right?
Oh,
so
good.
I happen to have a pelvic floor with me today, just
That's
in
awesome.
case we talked about
Yes,
it.
do tell us.
So, yes, so in your pelvic floor, you have 3 major organs, okay? You have your rectum that sits in the back. You have your uterus and cervix, if you're a female, that sits in the middle. And you have your bladder that sits in the front, okay? So those sit on top of the pelvic floor and pass through the pelvic floor. So people don't know what the
there's a
pelvic
lot
floor
going on
is.
there.
There's
Yeah.
already a lot going on and we just started. So anything that you see here that is white is your bony pelvis, right? Anything that is white is bone. But anything that you see here that is red, so all of this red and
a
all
lot
of
of
the red
muscle.
on the bottom is your pelvic floor.
Oh, wow.
So the definition of your pelvic floor is the muscular hammock or sling.
So it's the entire
The entire thing is the muscular
Wow.
hammock or sling that underlines the surface of the bony pelvis, okay? Without it, all of these organs would be sort of like hanging out
Just
down here.
falling apart.
Yeah, they're attached by
Wow.
ligaments, but you need the floor to support the organs.
Right.
And then they exit through this muscle and they actually go out through the pelvic floor musculature. So you have 3 major organs. So this is your bladder. It's pink, it's smooth, it looks like bubble gum or silly putty on the inside when it's healthy, right? That organ sits on the front of the pelvic floor. I don't know if you can see all this. Uterus and cervix is here, and then your rectum is in the back, right? And so all of this passes through the muscles of the pelvic floor, and a lot of
Wow.
people don't associate the organs with the pelvic floor, and they don't associate pelvic floor dysfunction with what could be happening to the organs. So if you think of a disc in your spine, right? If you have a herniated or a bulging disc in your spine, the muscles that are along the spine get weak or get tight because of that disc injury. That makes sense to people. But when you think about the pelvic floor, they don't think of it as a muscle, right? So if you have something going on with your bladder, like a urinary tract infection, if you're growing a baby in your uterus, if you have constipation in your rectum, the muscles of the pelvic floor can get weak or get tight. to sort of compensate for what's going on for one of those organs. Does that make
Wow.
sense to you?
Well, I'm thinking back my life and everything that you just explained, how much this actually makes sense.
Yeah.
But I never actually pictured how they're all connected, because
Yes.
that makes more sense why
Yeah.
one would come and see you, because there's a lot going on in
There's
there.
a lot going on. So then you
Yes.
would come see a pelvic floor physical therapist. You'd have an evaluation in a private room. You would explain what's going on with your pelvis, your low back, your hip, what your symptoms are. And there are different types of pelvic floor dysfunction. So there's pelvic floor weakness, there's pelvic floor tightness, and then there's a mixed pelvic floor, which is sort of a little bit of both.
Right.
Weakness of the pelvic floor is associated with incontinence, so you pee a little when you run, jump, cough, or sneeze. There's usually feelings of heaviness.
Which is very common for, like, especially if you've had any children,
so
right?
this is not
You're giving birth.
normal, but it's very common.
It's common,
Yeah.
but not normal, right? I've been
Yes.
told many times by the doctor that it's normal.
Yeah.
Don't worry about it.
But it's not normal.
Nothing that
I
can be
know.
done. It's just the way it is.
And I can help you with this. Yes. So heaviness, pelvic organ prolapse, where one of your organs actually slides slightly out of place because of weakness, and if you strengthen the floor, it'll just push it right
Go
back
back
up.
to normal. Wow.
Yeah, and then there's also pelvic floor tightness, which is different symptoms. Usually urination is difficult, it's hard to relax your pelvic floor, there's pain with intercourse, there's pain when you go to the OBGYN, hip pain, tailbone pain, low back pain are all associated with tightness. And then there's a combination of the two, is a mixed pelvic floor where you have a little bit of weakness and a little bit of tightness. So we kind of work on both. So a lot of patients will come to see me if they have any or all of those symptoms. We'll give them an exercise prescription, some breathing, stretching, strengthening, and we'll give them a functional program and that they can do every day at home, and then they come into the office and see us. So yeah.
Wow.
I know.
And this is amazing to hear, because I've had 3 children.
Yes.
And I've had many different OBGYNs.
Yeah.
So many different kinds of doctors in different facilities.
Sure.
And not once have I been told, right? I've explained the same issues that I've had.
Yeah.
Not once have they said, hey, you should maybe go to pelvic floor physical therapy.
Right. It wasn't as popular, right?
Yeah.
You know, in Europe, it's very popular, and everybody that has a baby gets a referral for pelvic floor PT. But
Wow.
somehow in the United States,
just
that's
not there
not
yet.
so much the case yet. We're getting better, but I'm here today to bring awareness to the pelvic floor and teach what it is. And then there's different types of incontinence you can have, right? There's stress incontinence, there's urge incontinence, and then once again, there's a mixed, which is a combination of the two. Stress is when you're running, jumping, coughing, sneezing, you put stress on the pelvic floor, and then you have an accident. It could be urinary, it could be fecal, it could be gas. Urge is more, I gotta go, I think I have to go, and then you're just going so frequently, and your brain and your
Wow.
bladder are
Check,
just
check,
not
check,
talking.
all of that.
They're just not communicating, and you have to
Wow,
retrain your bladder
right.
and your brain to communicate properly. And then there's a mix, which is a combination of the two. So if you laugh at something really hard you didn't expect to be funny, or you jumped on a trampoline and you pee, and you're your friend at the movies that went to the bathroom 4 times and nobody else went once, you probably have a little bit of both, right? So yeah, we talk about, are you weak, are you tight, do you have stress, do you have urge, or both? And then if you have tightness, we do internal releases. The therapist will actually do manual releases inside the patient during your appointment. So it's very hands-on, it's very helpful,
Wow.
it's very informative, and just a lot of people don't know about it, Nora, you know?
Right. Well, I mean, you think about how many, just with pregnancies, for example, right?
Yeah.
You think about the number of births
Yeah.
just in the state of Massachusetts, right?
It's a lot.
And if you were to really look at those numbers, you know, how many would actually seek this type of help, right?
Yeah.
Or are aware, I should say. They're not aware of
Yes.
this type of service.
So a lot of
which is-
OBGYNs are starting to refer to pelvic floor PT. There's a practice locally that all of them refer to my office. There's about 12 doctors in that practice because they're starting to understand what it is. But when I was going to the OBGYN, she literally said to me, I know you're a pelvic floor PT, but I don't really know what you guys do, and I send patients to pelvic floor PT. So can you tell me what you do during a visit? And I had to
Right.
explain it to the OBGYN that was already
What it actually is.
referring patients
Wow.
to pelvic floor, because
Right.
people just don't know what we're doing, right? So
Wow.
yeah, it's
Wow.
it's a new field. It's up and coming.
It's a great field, though, because
Yeah.
like I said, I've been to many OBGYNs, and
Yeah.
they always, if you have any most of the issues they assume or they recommend you take birth control.
Yep.
It will solve this problem, that problem. But what about, side effects? And then also there are many people that are not into taking medication. So if you can take the natural way.
This is much more natural.
That's absolutely something I would do. So what are some signs? You already gave me the signs, but is it something that you see more so after birth? Is it more for women, or do you see it in males as well?
Sure.
They might need this type of physical therapy.
Yeah, so it's males and females both can have pelvic floor dysfunction. It is very common around perinatal, which is around pregnancy, prenatal, postpartum, during pregnancy, because there's so many hormonal changes, the weight of the baby on these muscles, right? It's a lot of weight, and the weight of the organs, the uterine wall gets thicker, there's a lot of fluid, the baby, everything, the placenta, it's a lot of weight on the front of the floor, and then the relaxin hormone sets in, making the tissues expand, making everything a little bit softer. So yes, a lot of things tend to happen when you're pregnant, before, during, after. There's a lot of trauma with childbirth that happens. So yes, a lot of it is revolved around pregnancy. So we have a lot of babies and a lot of women who are pregnant in my office. But we do have male pelvic floor patients as well. I think some are just, they don't really talk about it. And there's probably should be way more male pelvic floor patients, but it's just not. Women are really starting to talk more about it, but everyone should be talking about it, because we all struggle with some type of incontinence at some point and some type of pelvic pain at some point. And then there's weakness issues with males with erectile dysfunction or testicular pain. So we can help with all of that in my office.
That's amazing. That's great. So are there any lifestyle habits that help maintain a strong and healthy pelvic floor?
Sure, yeah. So drinking a lot of water is number one, and I know everyone says that, but who actually really does that? Limiting alcohol and caffeine is really helpful because there are 5 bladder irritants. Well, there's more than 5, but the 5 main ones are carbonated beverages, alcohol, caffeine, spicy foods, and citrus. So, so all of those things irritate the bladder,
so trying to avoid
and make
or have
you
less
feel like you have to go frequently when you actually don't always have to go. So limiting those bladder irritants would be one of my recommendations. Not pushing when you go to the bathroom. You're supposed to sit calmly on the seat, have both feet flat on the floor. You're supposed to take deep breaths, and you're not supposed to push at all.
Really?
Yes.
Oh, that's a shocker to me.
Yeah. And then you're not supposed to jick, so just in case pee, like, oh, I see a bathroom, I'm just going to go use it because it's right there. That's called jicking, and you're not supposed to do that because that creates an urge incontinence. It makes you have to go more frequently than you actually have to go. So yeah, all of these little,
that's impressive.
Little things that you could just do daily, and you
really
would
make a difference.
Not create a pelvic floor dysfunction.
Wow, that's awesome. So when should someone seek professional help instead of just doing exercises on their own?
Sure, so everyone should seek professional help at some point, just to have it evaluated and just have your body evaluated, or your pelvic floor. It could be orthopedics or pelvic floor. Everyone should come in for an evaluation just to make sure everything's in line. But yes, you should see a pelvic floor PT if you have any type of pelvic floor symptoms, because it might be weakness, it might be tightness, it might be a mix. And so if you have pure tightness of your pelvic floor, you're actually not really supposed to be doing Kegels, because you'll be making it tighter. And,
really?
Right?
I feel like that's what everybody
just gives Kegels, right? And that's not the case. If you have weakness, yes, you should be doing Kegels, which is an exercise where you engage your pelvic floor muscles, you pull the muscles in and up like you're trying to stop your flow of urine. Some people will say pretend you're sucking a really thick smoothie through a really skinny straw with your pelvic floor, and those are the muscles that you're trying to engage, right? But you're not supposed to be doing that regularly if you're already too tight, right? You want to be
Right.
doing breathing, stretching, relaxing, and then you should see a therapist because they actually manually every visit do internal releases on the pelvic floor to release you from the inside out. You could get a blossoming tulip ball, which is my product that I had in our last segment.
Yes, yep.
It's over there. But yeah, you could sit on the ball to open up the pelvic floor, but you should really see a therapist to find out, to be diagnosed
just
properly.
to be sure, because you may think you have a tightness, but you actually have the opposite,
Right.
and you have to do completely
And then you're
different
doing the wrong
exercises.
stuff.
Right, you're just doing a disservice to yourself.
Yes.
Yeah, exactly. So what's one thing people can start doing today to improve their physical health? Like you mentioned earlier, there's a few things they can do, like the foods and
Sure.
that type of thing. But is there something else that they could possibly do on their day-to-day, especially if someone is sitting on a chair all day?
Yes.
And they have a lot of upper or back tension. Like,
Sure.
what can they possibly do?
Yeah, so obviously when you have extra weight on your body, there's extra weight on your joints, which creates more pain. It also creates problems with your pelvic floor. So just like eating a really healthy diet to try to keep a healthy weight is really healthy for orthopedics and for pelvic floor physical therapy. Taking a walk or some type of regular exercise will keep you in a healthier body weight, but also keep your body movement, keeping you moving basically. Drinking lots of water is always like the answer, and I know
It is for everything.
we all drink coffee and tea, but water, really adding in more water into your daily routine, and then getting a desk that is standing, right, or a walking pad. I just recently got one at my house, and
What's
it's
a walking
great.
pad?
So it's a little treadmill that fits right under the couch, and then I can put it at my standing station where I have my laptop, and I can actually walk. I try to walk for 60 minutes every day while I'm on my computer.
What?
So it's like a treadmill desk, right?
Wow,
So I
okay.
get the walk
Yep.
in, I'm standing, I'm moving, so I'm doing, and I'm drinking water. So I'm really
You're
doing
them
all
all.
of those things
Oh,
every
wow.
day.
And you have those at your practice, so that's what
We do have standing
I see them,
desks,
but I had
yeah.
no idea what that was.
Yep, they're
Okay.
desks on wheels and they're all standing. There's no sitting desks at my office. Yeah, because
Wow.
it gets you out of that kyphotic forward posture, forward head posture, rounded,
Right.
rounded shoulder.
I know.
Yeah,
Yep,
I know.
I see
know.
that
We're
my
both
posture
sitting up
as well
straighter.
as you're talking about
I know.
it. Like, I'm really,
But that is
No.
great for a lifestyle, right? Getting upright, right? Sitting is not great for your discs. It's not great for your back. It's not great for your pelvic floor. You want to be standing and moving.
right. Okay, that's good. So how can people find a good physical therapist? What should they look for?
Yeah, I mean, they're like any profession. Some are better than others. I like to think my office is the best. There's 6 of us. We have 6 amazing PT doctors. And we all have certifications is really what you want to look for when you're picking a PT. You don't want just a physical therapist, right? You want them to have different certifications, different
sort of studies.
experiences. So a lot of letters after their name is usually a pretty good sign that they have a lot of certifications on top of their PT license. So yeah, you want someone that might be dry needling certified, might be pelvic floor certified,
Right,
might be a strength and
specializing-
conditioning specialist
Yeah.
for sports and orthopedics, might be a registered yoga teacher to pull in the more yoga holistic part. Someone that is an athlete themselves, right? So if you're an athlete, you might want to go to a PT that's also an athlete.
Focuses on that. Right?
Yeah.
It's like finding a mental health therapist, right?
Right.
If you're grieving a loss, you probably want to go to someone who specializes on that. So it's kind of similar
Sure.
in that sense, right?
Yeah.
But I think for your practice, it's different than others because you pretty much can see anyone.
Yeah,
right?
we all are very similar. We all collaborate. We all talk to each other. We share patients. Where some practices you go to and everybody has their own specific patients. Ours is a little bit more collaborative is the word. And we all work together. We all train together. So if you want to come see me, you could see me, but you could also see one of the other doctors in my practice, and that is the closest thing to seeing me. And we all give an excellent treatment, I have to say.
I'm going to have
Come
to agree
and-
with you.
Yeah.
I've hands on. I've been there. I've experienced it. So that's great. Of course, where can viewers find you and see you or get some sort of physical
Sure.
therapy help?
Yeah, so if they want to find me, our website is bostonhealthwellness.com. It's a really nice website. There's lots of great pictures.
It's
the
very
dogs,
clear.
the physical therapy dogs, my
love the
PT
dogs,
puppies,
yes.
Samuel Adams and Paul Revere, they're at the office when I'm there, and they work there, and they sit on the patients and keep them emotionally supported. But yeah, you can go on the website, bostonhealthwellness.com. There's a button on the top right that says request an appointment. You fill out the form, you can become a patient as easy as that. We take all health insurances for orthopedics and for pelvic floor, which is rare. Typically for pelvic floor, places don't take insurance, so we do. So take advantage of it while it lasts, because I don't know how much longer we'll be able to do that if we keep getting busier. So yeah, but we love it. And you can find us there. If you don't live in the area, you can go on my YouTube channel. I have a ton of videos on there. I have a bunch of content. It's Boston Health and Wellness, A-N-D and Wellness, where the website doesn't have the and. So yeah, and there's videos of me teaching about the pelvic floor exercises, orthopedics. There's a bunch of shorts that I filmed, short videos that are quick for short attention span, right? You get right to the point.
Right.
So yeah, that's where you can find my information. Instagram is at Boston Health Wellness, Facebook, same thing, at Boston Health Wellness. Or you can come and see us. We're right in Stoneham,
person, right,
Montvale Ave, right off the highway next to the Play It Again Sports. Yeah,
that's awesome.
Come in, see me, meet the dogs.
I mean, you have so much. You offer so much to just about any individual, and I like that because it, like you said, it's very rare to find something like that, a practice that can really support so many individuals, and it doesn't matter what age group as well. So, Stefanie, thank you so much for being here. I feel so lucky to have you here and be sitting next to you. So, thank you so much.
Thank you.
I hope, and I know the viewers will find all this information very helpful. So, thank you.
I had a wonderful time. Thanks.
Great.